Today we have Alexandria Morgan speaking, and I'm going to read a little bit here. So Alexandria is a licensed marriage family therapist, and her practice is here in LA. It's called Her Healing, and it's an organization to provide mental health services and education for women, children, and families. And she specializes in trauma work and helping her clients achieve emotional, mental, and physical healing. And she provides workshops and presentations on trauma, coping skills, compassion fatigue, relationships, and other mental health related topics. She is certified and trained as an EMDR practitioner, and her passion is to bring positive healing to the impact of trauma on individuals and their communities. So today, she's speaking to us about the relationship between sexual abuse and sexual dysfunction. So please welcome Alexandria.
Hi, thank you so much.
Of course, thank you.
So thank you all for being here today. And I did a quick poll at the beginning just to get an idea of how many of you currently work with sexual dysfunction or sexual abuse. And for some of you, you understand the connection and it makes complete sense how the two are related. And for others, maybe not so clear. So this workshop is really just to understand the relationship and then understand how to assess for it when you get clients that are struggling with one or the other, and how to facilitate that exploration for them. Okay. So before we get started, I do want to just want to note that although today's training is discussing, assessing and the relationship between the two, it's also really important that when we do get a client who comes in with a sexual dysfunction disorder, that we refer them to a doctor first to make sure that it's not a medical issue. As mental health professionals, we can treat the emotional and social aspect of it, but we want to make sure that we're protecting our clients and that it's not something that needs to be taken care of on a medical side. Okay, so trauma. Unresolved traumatic events from the past live in the energy system of the body, Northrop. So I really like this quote, and I think it directly pertains to what we'll be looking at today, just how trauma does sit in the body, and even though an individual may not process it or be consciously aware of it anymore for various reasons, it does still impact their behavior. So we will see that when we get clients. The learning objectives today are to assess for history of sexual abuse, understand the relationship between sexual abuse trauma and sexual dysfunction, and understand the relationship between sexual abuse trauma and sex addiction. Sexual abuse. So the definition that we're going to use today is harm done to a person's sexuality through sexual domination, manipulation, and exploitation. So there are some, you guys have handout slides, but there's some information that are on the slides that I'm presenting from that may not be on the slides that you have. So you have pens if you want to make notes or add anything, just so you're aware you're not looking and searching for the slide. Sexual trauma symptoms. So when we talk about sexual trauma and the way that it'll be used today, we're referring to sexual abuse, which is sexual assault. An example of that is rape, sexual harassment, and child sexual abuse. And there are other examples of sexual abuse. These are the ones that we'll be referring to today. So symptoms include avoiding fear, lack of interest in sex, experience negative feelings such as anger, disgust, or guilt regarding touch, difficulty becoming aroused or feeling sensation, emotionally distant or not present during sex, intrusive or disturbing sexual thoughts and images, engaging in compulsive or inappropriate sexual behaviors, difficulty establishing or maintaining an intimate relationship. Sometimes they experience vaginal pain or orgasmic difficulties, as well as erectile or ejaculatory difficulty. So these are just different symptoms that sometimes are linked to a history of sexual trauma. So I want us to look at a case And this case is based on a real couple. I'm going to read it, and then we will come back to it later. It was a cool November evening, wrapped in big fluffy towels. Sally and Jim crept onto their secluded backyard deck, took off the cover of their hot tub, slipped out of their towels, and eased into the hot water. Relaxing in their hot tub was one of their favorite things to do together. For Jim, it was the only time Sally seemed comfortable letting him touch her anymore. Since their wedding day 6 years earlier, their sex life had been a problem. No matter what Jim tried, Sally never seemed aroused. Now they would let a month or two go by without having sex. Lately, Sally would even pull away from him when he would start to give her a hug. But something felt different tonight. Once in the tub, Sally began touching Jim. He was surprised, even shocked at first. Sally stroked him in ways she never had before. Jim laughed, telling her he felt attacked. He was delighted too. All of a sudden, Sally broke down. She sobbed uncontrollably. Jim was shattered. Jim leaned toward her. "What is it, honey?" he asked. Slowly and tearfully, Sally said, "I don't know why, but I find you a sexual bore. I'm not interested in having sex with you in the least. I'm really close to having an affair with another man." So just listening to that example of a couple experiencing sexual intimacy difficulties. And if we look back at sexual trauma symptoms, are there any symptoms that you hear or that stick out to you as being maybe something that could be linked to sexual trauma, or just symptoms in general that relate to some type of relate to a sexual dysfunction? Anything that you guys notice?
Only her lack of interest is what I'm hearing.
Okay.
The difficulty in maintaining intimate relationships.
Yeah. Yeah.
And why does she think it's going to be better with somebody else?
Yeah, exactly. So all of those things are things that we're just, we can pull out just from these symptoms. And, as therapists, we know that there's not a textbook method, right? So there's not just a group of symptoms and every client has to express those. But it's just important to be aware when we see clients and we're assessing them for initial sessions, what might come up based on what they're sharing with us about their problems. Hi. So we know with trauma, and sexual trauma is no different, that when trauma occurs, an individual experiences a fight, flight, or freeze response, right? We know that adrenaline, norepinephrine is released from the brain, from the body, and it causes our neural system to go into this response where we want to protect ourselves. And there's a lot of energy that's ignited in our body at that time. Cortisol is also released in our body, and when this is released, it takes energy, its focus is to remove energy from organs that are not necessary to defend ourselves to organs that are, like our muscles. And when cortisol is released, sometimes there's an increase of cortisol in the hippocampus, and what that does is when there's so much, it causes someone to experience a loss of memory. So this loss of memory, including the freeze response, when our body is overignited with all of this energy and this desire to defend ourselves or react, and we can't, then our system shuts down, and so we freeze. So when individuals are experiencing a trauma, but they're not able to escape or not able to defend themselves or do anything, then their system becomes overignited and they shut down, they freeze. So this is just something to be aware of, because sometimes clients come to us and they don't have a real memory of any sexual trauma in the past. Or they've buried that sexual trauma, so they're experiencing behaviors that could relate to symptoms, but they're not aware themselves of where's the connection. They don't have that insight. Triggers are what causes their body to continue to react in present day time. So they may have experienced a sexual assault a long time ago or sexual abuse a long time ago in their past, but more recently, their body is now responding to certain triggers and engaged in in reference to current intimate relationships. So we also see an attachment, fear of intimacy, and how many of us are familiar with the cognitive triangle, right? So this is what I call the cognitive behavioral square. So easy to remember. But when we look at sexual abuse, a lot of times there are body sensations that are present. And when someone is engaging in current intimacy, they notice that they're experiencing physical sensations. And sometimes their awareness, their insight isn't to recognize the linkage between those physical sensations and their past, and recognize that as also a trigger. So as you know, therapists and professionals, it's helpful that we understand with trauma, yes, we're aware of how thoughts can be triggered, our feelings can be triggered in certain situations, and then those can impact our behaviors. But it's also to be aware of, it's also important for us to be aware of physical sensations and how those can also be linked to why someone is behaving the way that they are. Are there any questions about that?
Can you give us an example of that?
Yeah, so we'll see it again in the scenario that I read earlier. For instance, and I don't want to share too much, but it'll come up. So we'll do some different case examples. So you'll see an example of how they're all kind of linked together. Sexual dysfunction disorders. A heterogeneous group of disorders that are typically characterized by a clinically significant disturbance in a person's ability to respond sexually or to experience sexual pleasure. So there are a number of different sexual dysfunction disorders, and for the purpose of this presentation today, we're not going to focus on all of them, although it's important for us to know that they all can be related to a history of sexual abuse. We're going to focus on female sexual interest and hypoactive male desire disorder. Okay? So sexual anorexia, which is not in the DSM, although I'm sure a lot of us feel like it should be, is an avoidance of sexual experiences or intimacy. A dread of sexual pleasure, obsession and hypervigilance around sexual matters, avoidance of anything connected to sex, including intimacy, preoccupation with others being sexual, obsessional self-doubt about sexual inadequacy, and worry about the sexual intentions of others. So just in reading these, excuse me, there's a lot of anxiety that sticks out. So knowing about just trauma in general, we know there's a lot of anxiety that goes along with trauma. So being able to link sexual anorexia with trauma, we just see the correlation with anxiety.
What's the preoccupation with others being sexual?
Yeah, so that one's an interesting one. Obsessional preoccupation with others being sexual. So it's this anxiety with sex in general. And when we think of, which we'll explore a little bit more a little bit later, but when we look at just those who are sexual anorexic, they're withdrawing from sex, right? So their intention is to avoid having sex. But that doesn't mean that they're not thinking about sex and that sex isn't on their mind and that it doesn't cause anxiety in general. So this preoccupation with what others are doing sexually is sometimes present because there's an interest in sex. There's an interest in intimacy, but they're withdrawing from it on a behavioral level because of trauma. Does that make sense?
Well, I thought porn at first, like somebody who watches it but doesn't participate. That's what I was imagining. The word preoccupation made me think that.
Yeah, yeah. And in a lot of times, not a lot of times, but sometimes you may get a client and there may be behaviors that they're engaging in sexually, but they're not intimacy behaviors. Right. Yeah, so sometimes that's their way of avoiding, that helps them to avoid the sexual intimacy with someone. Okay, so sexual addiction, an obsession and preoccupation with sexual behavior, a powerlessness to stop at will. The sexual addiction results in harmful consequences, causes unmanageability in other areas of life, escalation of use pertaining to sexual addiction or as a means to cope or escape. So a lot of these, again, are just, when we think of addiction in general, whether it be like an eating disorder or whether it be like drug addiction, a lot of these are similar, but in relation to sex. Experience a decrease in functioning after attempting to withdraw from sexual behavior. And a lot of times people, this one is interesting for people. It kind of sends out like, well, there's a withdrawal sense. But yeah, there is a withdrawal sense because it's an addiction for them. It causes them, there's an emotional reason that's associated with the behavior. So withdrawing from the sexual behavior causes one to experience a decrease in their functioning because the addiction helps them to function. Does that make sense? Okay. So assessing sexual abuse and dysfunction. A lot of us are aware of just different questions to ask during assessment when we get a new client in general. It's important to think of childhood history, so exploring relationships and attachment with parents and other family members. So what were their early attachments like with family? Whether that be siblings, whether it be parents, whether it be grandparents, what was included in that attachment? Was it an emotional attachment? Was were there physical touching involved? And then current sexual experiences and satisfaction. Are they currently able to engage in sexual experiences and become satisfied? Are there sexual experiences that they're actually having, or are they not having sexual experiences at all because they're withdrawing or avoiding them? History of sexual partners and intimate relationships. What was their first intimate relationship like? What was their first sexual experience like? Was that something they enjoyed, or was it something that made them, avoid sex for years afterwards? Are they engaging in sex, or are they engaging in sexual experiences and able to connect with the person and feel an emotional attachment with that person, or are they just engaging in sexual experiences without the intimacy or emotional connection at all? Another really important one is emotions, thoughts, sensations during sexual experiences. So just pausing and breaking down with them, okay, so, what is your sexual experience, your most recent sexual experience like? Maybe they're with a partner that they frequently have sex with just one person. Maybe there are multiple people that they have sex with. But what are the emotions that come up when they're engaging in that sexual experience? What are the thoughts that come up for them while they're engaging? What are different sensations that they're having? Is it pleasurable? Is it painful for them? Do they not feel any emotional connection at all when they're engaging in these experiences? So these are really important questions to get an idea of, are they being triggered at all? Is this what we would consider a sexual experience that is enjoyable for them and their partner, or is it just enjoyable for their partner and not them at all? Sexual abuse. The next slide we'll go over just the difference of covert and overt sexual abuse, but definitely being really direct with assessing this and just asking the question, you have a history of sexual abuse? Have you ever been sexually assaulted? Sex frequency, like the case example we read earlier, they had been married for 6 years, but they hadn't engaged, they were engaging in sex, but it was, like once every 2 months. So just thinking about, okay, well, is that normal for your relationship? And if so, why are you with like not having sex? Is there a reason for that? Is there an avoidance involved? Yes.
Can you express your thoughts about the difference between no memory being due to a flooded hippocampus and when there just wasn't, those events didn't actually physically take place? They may have psychically been experienced on some level, but not necessarily physically. And how do you assess that?
Yeah. So really all of these are really important in order to determine that, because sometimes we have individuals that, they're experiencing, for instance, a lot of emotions, a lot of thoughts, a lot of sensations during a sexual experience, but they have no memory of having a traumatic sexual experience at all. And that could be the case. But the more you assess different things in their life, the more you ask questions about it, the more that they're able to talk about it comfortably. Sometimes those things eventually come up. We'll discuss a little bit later just the difference between covert and overt sexual abuse, which a lot of clients, they just struggle with understanding what is sexual abuse. You know, you may ask them, have you ever been sexually abused? And they say automatically no, because they don't remember, you know, an adult male sexually abusing them. But there are other types of sexual abuse. So we'll get to that. And then masturbation, frequency, onset. Are they stimulating themselves and able to get an orgasm, but just not with an intimate partner? So the ability to be intimate with someone else and connect with someone else on an emotional level is something they're avoiding, but they're able to pleasure themselves. So that's important just to know also. And then when did they begin masturbating if they do? Sometimes we see a lot with child sexual abuse that they enjoy the sensation that happened during an abuse. And so they continue with trying to create that stimulation for themselves. So they begin that at a very young age and may not remember what initially caused them to start masturbating, but it's a habit that they've continued, you know, throughout their life. And then pornographic exposure is similar to masturbation in the sense that maybe you've seen something as a child and weren't aware that it caused you to feel really good. It caused a positive sensation. And then you sought that out. And it turned into something that will, you know, this is something that does give you pleasure in a sense, but without the intimacy or the connection. Okay. So looking at overt and covert sexual abuse, we're all pretty familiar with the overt. Sexual intercourse, fondling, penetration, kissing, hugging, exposure to pornography, you know, someone taking pictures of you. Like these are things that we hear about when we know our mandated reporting responsibility, right, when it comes to child sexual abuse. However, covert is not something that we discuss as much. And with covert, a lot of times people view it as emotional abuse. I put Jada down. This is my dog. How many of you guys have dogs or cats? Okay. So I don't know about you, but I definitely have a blurred attached relationship with my dog. So she comes in the bathroom with me when I'm using the restroom. She'll sit on the floor when I'm taking a shower or a bath. I come home. If I had a really stressful day, I go to her. We talk about it. She makes me feel better. I cuddle with her, sleep with her. So these are all things that I do with her, and I unload my emotion onto her and depend on her in that way. And sometimes we see that children are being used in that same way for their parents. And when this happens, it's covert sexual abuse in a lot of ways because it's blurring the lines in the role for the child. So when they look at the relationship with their parent, sometimes there are feelings that come up for them, you know, feelings that aren't necessarily normal for a child to have about a parent, but it's because their parent depends on them in that way, as if they're a relationship like partner for them, on a level of intimacy that shouldn't be between a parent and a child. See if there's anything more I want to talk about that.
And it doesn't have to be sexual. I mean, it's just emotional.
Exactly. Exactly.
Like trying to get comfort from the child.
Yes. Yeah. Sometimes it can be sexual. And an example, I had a client who expressed growing up and feeling really uncomfortable around her father. And she loved her father, felt like they had a really great relationship, but she remembered him commenting on her physically sometimes. And he may make a comment in a joking way about, oh, you know, your breasts are growing really big. And so that would make her feel really uncomfortable because that's her father commenting on her, on a sexual body part of hers. And so that is something that we might not think as being sexual abuse, even though we say to ourselves, well, that's not really appropriate. But for a child growing up in that environment, it is really confusing. And if, you know, a mother goes to her son with her emotional, issues and wants to sleep with him for comfort, that's also a blurring of the lines. It's not really sexual, but it does kind of create that confusion for a child, in terms of, well, what is intimacy and, what is this relationship supposed to be like? Sometimes that does result in sexual anorexia because it's avoidance of the intimacy, because the intimacy makes them feel uncomfortable or brings up feelings from them that they never processed or never dealt with.
I think the dog is a good example.
Yeah.
It's a very clear example.
Yeah. She was with me when I was writing this, and I was like, I definitely do this with you. So I want us to look at a couple of scenarios, and then you have assessing questions and points in your notes. And maybe we can just think of, well, what are some questions that we could ask in regards to this that might allow us to pull out more information. So I want my husband to find me sexually attractive. I'll go to great lengths to improve my appearance so that he will. I wear sexy clothes and paint my nails. But if he gets sexually excited and interested in me, I'm annoyed. Why do I feel disappointed when I should be glad? And then if there's anything in regards to, there's not a lot of information in this, but anything in regards to, well, sexual addiction or sexual anorexia, or kind of what might be going on for this person. There are 3 different ones, so you can always add that in too. But what might be some questions that you could ask to further assess what's going on here?
I want to know who her husband is standing in for,
Yeah.
whether it's a father or an abuser or something.
Yeah, good question. Anything else that you guys are?
I would just ask what her expectation was. What did she imagine was going to happen when she got stuff?
What was she? What did she
What
want
did she
from
picture
doing that?
was gonna happen?
Yeah. What was her motivation for doing that?
Well, it sounds like she wants to be desired, but she has some sort of fear of intimacy.
Exactly. Yeah. Yes. Good. So history of current sexual experiences, satisfaction, assessing thoughts and sensations during intimacy. What were you thinking? What was your motivation before? When he started to become interested in you and aroused, how did you respond? What were you thinking or feeling? Sex frequency. Do you guys have sex? Is this something? Does this happen every time that you are engaged or engaged sexually with your partner? And then also just looking at, has this always been that way for you, or who is he standing in for?
I go into a relational question though too. I mean, if he only gets aroused when she decks out completely,
Yeah.
then that speaks to something in the relationship. And
Yeah, exactly.
yeah.
Yeah, exactly. And with couples who've been together for a while, they've developed these patterns in their relationship. And just understanding that before they came together, they were 2 separate people with 2 separate experiences and histories that are contributing to the patterns that they're now creating in their relationship.
Yeah, I love what you just said too, because it makes me wonder, would she feel desired if she were just in her sweatpants and
Yeah.
just being who she is, and is
Yeah.
some of that disappointment or anger because she feels like she has to be? I think it's great.
Yeah, exactly. Yeah, great questions to ask. I was having sex with my boyfriend when I suddenly became uptight and anxious. My thoughts scattered and dispersed like detergent in a pool of oil. I was totally unable to have an orgasm. I couldn't focus. I kept short-circuiting before I'd get there. I didn't know what was happening with me. It was scary. I think just before we get to just assessing questions, I think it's important to realize just the lack of insight and the lack of connection between like what's happening to me, my sensations, my feelings, my thoughts, and then what might actually be triggering those things for me, and where does that come from? So with our clients, asking all these questions and really assessing and, finding things to pull out and then asking questions about those just to explore it for them and for ourselves is helpful, and that enhances that insight for clients where, we're not telling them that something happened, but sometimes just doing that allows them to put pieces together on their own. Any questions that you guys think might be helpful to ask in order to assess further here?
I would ask whether it's the first time she was having sex with the boyfriend.
Yeah,
or
good question.
whether they've been sexually active before, and whether she experienced it previously during sexual encounters.
Good.
And if not, what was it about the specific,
Situation,
situation?
Yeah. Good question.
Yeah, and what acts they were actually doing
Mhm.
exactly when it started.
Mm-hmm.
Get more specific in what they associate with that particular experience.
Yes. Yeah, because we know that with trauma in general, there are triggers, whether they be conscious or unconscious triggers, and a lot of times they're unconscious because the individual has not fully processed that trauma. So history of sexual partners, intimate relationships, assess for child sexual abuse, overt and covert, which pointing out that, well, what actually happened in that instance? Maybe they were touched a certain way, maybe someone said something to them that triggered something, an uncomfortable feeling, and then they responded in a way to regain that control for themselves. Assess masturbation frequency and onset. Are they able to please themselves outside of this type of sexual experience? And that could be really important just to have an understanding with, okay, well, maybe it is something about this that's causing them to be triggered. Okay. I wanted to study body work. The training involved giving and receiving many types of massage. I became sickly afraid of having people touch me. Lots of fears came up in class. When I got home, I wasn't able to relate sexually with my boyfriend. It was then I realized that I had a problem with touch and sex. Any questions that you might want to ask to assess a little bit further?
So I keep realizing, so I'm Gestalt oriented, and
Oh.
now I'm realizing how entrenched I am in it.
Oh.
And it's funny for me because I'm looking at like what's happening here now, which like, and so I'm wondering like when you're thinking what's in the room because there's so much intimacy and then discussing these things, like what's to be said about what's going on between you and the therapist then?
Yeah.
I mean, do you discuss that? Like about, are they comfortable or not even talking about these things just to start?
Well, I think that could be a great assessment question, right? Just to understand, well, what's coming up for you in this moment. Are you experiencing any anxiety or fear or, emotions of shame, just sharing it with me?
Yeah.
And that could lead to other things.
Yeah. I don't know, that's how I was
Oh.
come today to learn, like
Yeah.
what's, how do you deal with what's
Yeah.
going on right there?
Yeah. Well, I think for a lot of, when there is a relationship between sexual abuse and sexual dysfunction, there is this desire to avoid feelings. And so even the sexual, anorexia is avoiding the shame, right, that comes with that intimacy. And then, when you're looking at sexual addiction, it's avoiding the shame by regaining control and then using their control to make others feel attracted to them or, to engaging in sex, but in a way where like, oh, now I have control over my body and myself. So it's an empowerment type way, but it's still avoiding the feelings that come up with intimacy, and it's still avoiding intimacy.
Yeah.
So you just addressing it and asking questions about it in the room, in the moment, is the opposite of what they've been doing.
That's what I worry about. Do I cause the shame? Like that's I work in a micro level where I think because I have a heavy like a BDSM client now, heavy sex addiction, and I'm unclear of like, wow, what's even going on right now? Am I redoing this? Am I recreating intimacy challenges? Yeah.
Does anyone
Other people
have any thoughts?
Anybody else? I find the main thing is how comfortable the therapist is with the content.
Yeah.
I think it's really immediately just people just through mirror neurons or just the rapport really respond to it. So if the therapist is uncomfortable asking about these things, I think that makes a huge difference.
Yeah, and I'm not. That's what's the thing. Like I have a ton of experience with sex addiction stuff, but I just started realizing I'm really not like I don't know because I'm not trained from an assessment. Like there is something happening between you and that client then. So I guess I'm just curious how.
But
You know what I'm saying?
they're coming to you because they do want to talk about
Exactly.
stuff. and it is an environment where they know they're not going to be lovers with you, so you're sort of, or assumedly, assumedly they know that, and so
It should not, yes.
so it kind of takes it out of the realm. I find, people are pretty willing to answer what you ask them, and I think there's a lot of relief because then they immediately experience that hopefully you're not judging them, so that just kind of starts to shave away a little more of that shame response.
Yeah. No, I agree. The relationship is important, and how us as therapists utilize that relationship and that connection really does impact a client and how they view themselves. Do you want to add something?
I was just curious whether the patient who is into the BDSM scene sees it as problematic.
No, and there's a plateau now. So there's something that's different. So yeah.
Good. Thank you for sharing. So childhood attachment, relationships with family members, what was that like? Emotions, thoughts, sensations during that experience. So he was able to identify that there were fears that came up. Well, what were those fears? So exploring that a little bit more. What were your emotions? Did you have any sensations during, when other people touched you? History of overt and covert sexual abuse. So it seems like this individual was engaged sexually with their boyfriend without any problems, but then more recently it came up, and sometimes that's what happens. It could be, these triggers could lay dormant for a very long time, and then something happens, and then it reignites the trigger. We talked a little bit before just about sometimes clients are confused about what is sexual abuse. And so when you ask them initially, it's a no, but we talked about kind of covert and overt, the differences between the two. So some questions to ask that were created by Wendy Maltz that might be helpful were you unable to give your full consent to the sexual activity? And that could be a range of different types of sexual activities, but were you a child under the age of 18? Because if so, then you couldn't give consent. Or were you under the influence of a substance? Were you asleep? Were you, forced in any way? So all of those, asking them, is it a yes or a no in regards to this question? And if there's an incident that occurred and you're thinking it's not, well, just being able to answer these might help a client to understand that, well, actually it was a form of sexual abuse. And so therefore that could be impacting you on an unconscious level. Did the sexual activity involve the betrayal of a trusted relationship? Was the person who sexually abused them or initiated the sexual activity, were they someone that was put in place to protect you? Like a babysitter or a parent or a grandparent or older sibling? Were they, a boss who used status to influence you to do something or for a sexual favor or harassment? Was the sexual activity characterized by violence or control over your body? So if you didn't have the ability to use your body as a force to protect yourself, if you were restrained or held down or anything like that, then that is an example of something, you could have experienced as sexual abuse in that instance. And then did you feel abused? So a lot of times this question kind of confuses people a little bit, and it kind of goes to what your question at the beginning. If you don't remember, can you, are you influencing someone to say that they were, or how do you stay away from that line? But if we think about did you feel abused, this really goes to the covert example of sexual abuse, because someone could have had interaction with someone, a family member, and maybe based on what, how everyone defines sexual abuse, it wasn't. But if you felt uncomfortable or abused or sexualized in some way by someone, then it really doesn't matter if we could check the box and say that it's sexual abuse. For that client, it's important for us to explore it as that for them because they felt like they were abused. So to dismiss it and say, okay, well, because we wouldn't be able to report that, then that wasn't exactly abuse at the time. but understanding that if they had a feeling, and for them it felt like abuse, it felt like, they were taken advantage of in that moment, then that's what we focus on as a therapist, and that's what we work with, was why did they feel abused? Because their feelings are valid for them. Any questions about that? Okay. So now taking a deeper look at just sexual abuse and sexual anorexia, and the relationship between the two. So sexual anorexia usually starts with abandonment or betrayal in regards to the sexual abuse connection. Profound rejection by a loved one or exploitation by a loved one results in the avoidance of mixing intimacy and sex. So if you were sexually abused by a loved one, and you understand that person loved you, that was a family member, well then there's this desire now to avoid that intimacy or to avoid engaging in sex with that person that you love, because in the past that person that you loved, or the person that you were intimate with, you engaged in sex with them and they sexually abused you in some type of way. So control over their bodies as a response to a history of trauma. If I give in and I have sex, nothing else is mine, because when I did that before, it was taken from me. So understand that there are thoughts that are going on in our clients' minds, and we should ask more questions about what those thoughts are, because those thoughts are motivating their behaviors as well. When one feels out of control, they can regain control by using sex to manipulate their partner. So what this could look like is, I had a client who was in a relationship and had a difficult time with sex with that partner. They would become really upset when that partner tried to have sex with them or approached them in a sexual way. And it wasn't that they didn't like it, but their emotion that they were feeling was, upset. And so they would resist and try and control, like, no, this is, I'm not doing this, I'm abstaining, I don't want to. So it's a lot of them using their control to manipulate the situation with their partner, to resist sex with them. And so when we think about the cognitive square, we think about, well, what were the emotions that were going on for that client in that moment that caused them to feel like they needed to control what was happening? Were they feeling shame in that instance because they were approaching a sexual interaction, and it reminded them of their trauma and their history of being abused and feeling shame. So that emotion might have came up for them, and so their response was, okay, I need to defend myself. I can't experience this shame. This triggers what happened. Maybe it's conscious or unconscious. So I'm going to avoid, right? But even in the avoidance, it makes me feel like I have control again over myself. So all of that is a lot of unconscious stuff that may be going on. When we ask questions, we can pull out things and help a client understand what were the emotions, what were the thoughts that were going on, and then help them to connect the dots instead of us telling them what was going on for them. Self-hatred as a result of sexual trauma can manifest itself, causing the person to feel flawed or defective, which results in shame. As a way to avoid the deep feelings of shame and a need for connection, one will seek to regain control by using resistance. By shutting down the need for intimacy, one regains control of their body and avoids the shame. Any questions about this?
I think, when one chooses to be celibate, a lot of times that's what's kind of going on. I mean, then they become in control.
Yeah.
There's this new show called Here and Now, and they really address a lot of this with one of the characters, because he's chosen to be celibate and not get involved in relationships. And when you flash back before that, you could see he was kind of a sex addict, having sex with a lot of women.
Yeah, I'm happy you brought that up.
And then when you flash back when he was a kid, he was in bed and his mom was several feet away having sex with various partners for money. So he grew up like seeing that of his mother. And then it's just interesting, now he's taking kind of the control to be celibate, not get involved, but in between he was out of control. So kind of interesting. He's not in therapy yet. I don't know his character, how it's going to continue.
Unfold.
But it's interesting because a lot of what you're talking about kind of is just shown in this one character in just a few episodes of that show.
Yeah.
It's
That is really interesting that, and I'm happy you shared that, because it was evident that based on his experiences, he had had childhood sexual abuse in some way. And that did impact his sex addiction,
Exactly.
right? So based on his feelings of shame, or there may be other feelings that he was having that he wanted to avoid based on not wanting to remember those experiences. But not only that, with sexual anorexia and sexual addiction, the underlying motivation for the behavior is the same, right? It's an avoidance of the feelings that cause one to feel really uncomfortable. It's also this desire to regain control over themselves and avoid that feeling. And they want intimacy, right? So that's something that they actually desire, but it's very anxiety-provoking. So this desire to have intimacy is something that, they struggle with. Well, I want it, but then I don't at the same time because it brings up everything that I've experienced and those feelings that I want to run from. So sometimes there's this cycle that occurs, and we see clients who go towards sexual addiction, but then because of the guilt that comes with that, and then they start to feel bad that they've engaged in all these sexual behaviors with these different partners, then they, at the same time, withdraw.
Yeah, it's interesting. It's just, one character of a whole bunch of characters, but it's just, it's interesting because so much of what you're talking about
Yeah.
pertains to the writing of this character.
Yeah. So you may see both. You may see, if you ask questions and assess further, you may see that at some point there was an addiction that was present, and then at another point there was this behavior to withdraw or avoid sexual interaction and intimacy. So there may be both present at different times. Sexual abuse and sexual addiction. A child who has been taken advantage of sexually is seeking a way to relieve the pain of victimization by regaining control. They have a core belief of, I am powerless, and seek to feel powerful by taking action to control their sexuality. So an example might be, I feel powerful when I get someone turned on to me. When I pull someone into that, then I feel powerful. But then the act of actually having sex with that person brings up all these fears, and I'm not interested in that. By adopting a new powerful belief through their actions, this becomes their reality, and their painful sexual trauma becomes an unconscious memory, which it sometimes started off as an unconscious memory. So whenever the buried pain associated with the traumatic core belief, shame, is triggered by someone or something, a person will mask their hurt using defense tactics to detach from their emotions and regain control. Thus, the protective response associated with the rejection, hurt, and shame can be avoided with the addictive behavior, the sexual conquest. Okay. So I want us to go back to, and I'll hand these out. You don't have these with you. So we went over the first page together. And if you want, you can read over the first page again to yourself, and then read over the back page. And as you're reading, just think about what are some questions that you could ask along the way to assess a little bit further what's going on. Thank you. Are there any questions that you can ask to assess further? And then are there characteristics of sexual anorexia or sexual addiction that you see? And how would you conceptualize this case for yourself? Any thoughts about where you might want to explore more, or questions that might be helpful to ask?
I'm wondering why they're not talking to start with.
Why they've just never addressed the fact that they're not having sex? Yeah.
Because otherwise I feel like you start to identify her too much as like a problematic element.
They're not talking, it's feeding the behavior. Yeah.
I'm curious whether they had a sexual relationship before they got married. Whether there was something about being family and having sex that then triggered memories of having sex with each other.
Yeah. Good question. Sometimes there are couples and one individual, fakes orgasm. So they engage in the sex and they continue to go with it, and they, fake enjoyment, and they, fake the orgasm, and never really address the fact that they're not getting anything from it, or that they are having feelings that they're avoiding and thoughts that are coming up, but they're avoiding those too. And that can also be something to explore further, but the individual never says anything about it. So it goes on until it gets to a point where they come into therapy to work on something either related to the sex or something different.
I would also explore that if they have any children and how that's impacting the interaction with their children.
Good question. Yeah. So in this situation, how would you conceptualize this? Or were there, in terms of just everything, whether it be questions to ask, information about symptoms of sexual abuse, information about sexual anorexia, sexual addiction, like how would you explain what might be going on here?
Well, conceptually, I would say that they moved into a sibling relationship, a sibling dynamic, and her comfort and intimacy with him was now a representation of the abuse she suffered from her brother, which made her tense and feel repulsed by any advancements toward him.
Yeah.
So I would start there and kind of teasing that apart and working on that dynamic. Because she was able to be attracted to this man she didn't know. So
what was
she
that
was
about?
capable of sexual attraction towards intense experiences, people who are unfamiliar, but he represents true intimacy that she's living with. Well, eventually 6 years, but so that's probably where I would start.
Yeah, good. And so we see the sexual anorexia there, where she's avoiding, but then at some point, sometimes there are these behaviors that come up where these impulsive sexual desires and behaviors where she's about to have sex or interested in having sex with a complete stranger. Yeah.
But also explore the coupling of eroticism and danger as opposed to safety.
Yeah. So all of the things that you guys are saying are really, really good questions and areas to assess further. And asking those questions and, including sexual abuse type questions and assessing for that too can bring up those things. Like maybe there are deeper meaning behind the behavior. Maybe there are emotions or thoughts that are going on there, or a change in how you view that relationship because you've been together for so long, and that's the trigger for your behavior. Yeah. The avoidance of painful emotions and memories cause one to unconsciously reject the need for love and intimacy. To protect themselves, survivors sometimes run from connection and obsess about sex, developing maladaptive behaviors that develop into sexual addiction and sexual anorexia. So these are just a few common treatments for sexual abuse and trauma in general. And then you have just terms in general in the back, and then references and resources that were used and could be helpful if you want to explore this more. Okay. Yeah. Does anyone have any questions or, yeah?
I have a question, just because I'm thinking of sort of like the covert sexual trauma. I'm at a college counseling center, and we see a lot of dysfunction with people like with onset of like guilt from like moving out of their out of family's house, and now they're in a college college environment. Do you feel like that could be, even though it's not sexual abuse, but there's a lot of messages, mixed messages about like not having sex, and now they have free will? Do you feel like there could be some connections between some of the dysfunction and that?
So mixed messages that they got from their family about not having sex?
Yeah.
Okay. And
or
then
negative messages. It's a lot of times negative messages.
Yeah, I would explore where those messages are coming from. Because sometimes, sometimes you get messages from your culture, you get messages from your religion. There are so many messages that we get about society about sex and what that should look like, and when you should engage in it and when not to. So, yeah, especially for college students, just exploring, where are you getting all these messages from, and, these messages are impacting you. Is that by choice, or is that by, this unconscious stuff that's going on? Yeah, good question. Okay. So I do have cards on the back if you want to grab a card. And I do. Yep, private practice. So thank you guys so much for coming.